My name is Melissa Wojcik, and today I'm going to be talking about the use of AAC within the acute care setting. The purpose of this presentation is to investigate the use of alternative and augmentative modes of communication for patients in the acute care setting. Alternative and augmentative communication, also known as AAC, is any time a person communicates without utilizing speech. For this presentation, several research articles were reviewed in order to gather information about past and present uses of AAC within the acute care setting. Many acute care populations have communication deficits and need an effective means to express themselves. It is the job of the SLP to provide education and access to AAC in order to ensure that the benefits are available to any person in the acute care setting. A little background about AAC. According to the American Speech Language Hearing Association, augmentative and alternative communication, otherwise known as AAC, is defined as any method of communication used to supplement or replace natural speech. Within the scope of AAC, there are two main branches of systems. The first type of system is an unaided system. An unaided system is one that does not utilize any tools outside of a person's body to communicate. This includes the use of gestures, body language, facial expressions, and sign language to communicate a message. Within the acute care setting, it is important to establish an efficient yes-no system that is readily understood by the necessary healthcare professionals. An efficient yes-no system allows the patient to be an active participant in his or her medical decisions. Patients can use unaided means to communicate yes and no within the acute care setting when speech is not a viable option. Depending on their motor capabilities, a patient could utilize designated yes-no head shakes, eye blinks, or signs to communicate medical information. These would all be examples of utilizing unaided means of AAC within the acute care setting. The second type of AAC system is an aided system. An aided system uses some sort of tool or device outside of the person's body. There are two types of aided systems, low-tech and high-tech. Low-tech systems, as can be gathered from their name, is any system that does not require the use of high technology such as computers or iPads. Examples of low-tech devices include pen and paper to write messages or pointing to letters, words, or pictures on a board. High-tech means, on the other hand, do require some sort of computer or other high-tech means for communication. Examples of this include touching letters or pictures on a computer screen that speaks for you, or using an iPad app like Proloquo to Go or TouchChat to generate messages. In the United States, approximately 1.3% of the population cannot meet their daily communication needs via natural speech. Within the acute care setting, there are many acquired disabilities who we come in contact with that may benefit from AAC. Examples of these include CVA patients, TBI patients, neurodegenerative patients such as someone with ALS, people with disabilities following surgeries, and people with temporary conditions. To give a little history about AAC, AAC began in the 1950s with many SLPs using AAC to enhance the communication skills of individuals whose oral and laryngeal structures were not intact. At this time, SLPs utilized writing as a primary form of AAC for people with limited or no speech capabilities. Moving on to the early 60s, SLPs within the field began implementing low-tech communication boards for clients with cognitive and physical impairments. Over the decades, as advocacy for people with disabilities grew, AAC services expanded. and populations that had not been served prior were getting the services they needed. Since then, the advancements in technology have revolutionized the world of AAC, opening the doors to more high-tech devices and new and more efficient communication systems. Despite tremendous gains within the practice, AAC is still not often seen as a priority within the acute care setting. For patients in the acute care setting, they can have either temporary or permanent communication deficits to be eligible for AAC services. Within the acute care setting, many patients of varying etiologies present with severe communication deficits. Recent research of these patients with severe communication deficits in the acute care setting reports patient dissatisfaction with communication between themselves and their families. It also reports dissatisfaction of the patient's communication between themselves and the nursing staff. While this breakdown in communication is problematic, AAC has been proven to be an evidence-based approach to improving communicative interactions and patient experience. This will improve overall patient, family, and nurse satisfaction with the acute care experience. Though AAC does theoretically pose a solution to the communication problems, there are many challenges to be faced in the implementation of AAC within the acute care setting. In a study done surveying acute care nurses, one challenge that frequently arose was the nurses' lack of education regarding AAC. Nurses and other medical staff outside of SLPs are not experts in communication and therefore often do not feel competent implementing communication strategies outside of speech. An additional challenge that came up for AAC implementation was that communication was not considered a priority in the acute care setting. For patients in this setting, the number one priority is medical stabilization. Nurses are more concerned with the health of their patients rather than their ability to effectively communicate with the nurses and other healthcare professionals. Along with this, acute care settings operate with a very quick in and out system. Nurses are instructed to get the patients healthy and get them out of the unit as soon as possible. With the demands on the nurses to discharge, many of them believe there is little time available to implement AAC. One last challenge that was frequently reported was a lack of access to AAC. As mentioned, nurses are not experts in communication. If the SLP does not provide access to some sort of alternative means of communication, it is likely that the person will not receive it. The patterns and attitudes discussed in this presentation have great implications for SLPs who choose to work in the acute care setting. The first, and perhaps most important job of the SLP in regards to AAC in the acute care setting is to educate the patients and the staff on how to use the systems. A mutual knowledge of how to use the system for effective communication between the healthcare professionals and the patients is essential. Effective communication improves patient safety, patient experience, and overall personhood of the patient. Having a means to communicate allows the patient to play an active role in his or her medical care plan. It also provides doctors and nurses with relevant medical information and helps maintain a level of independence for the patient. Additionally, educating the nurse on how to effectively implement the AAC system will allow them to feel more comfortable communicating with the patient, which improves overall nurse-to-patient relationships. Lastly, educating the family on how to implement AAC post-acute will ensure the patient has a means to communicate at home. The family will be the people who serve as a communication partner most of the time. Providing a system that is easy to understand and easy to use will keep the patient an active member of their life, even if speech abilities are not restored to their previous condition. Another important job of the SLP within the acute care setting regarding AAC is providing the access healthcare professionals and patients need to the systems. In other settings, AAC is often highly individualized and can vary from extremely high tech to completely unaided. Because of the limited time in the acute care setting, trialing high tech devices and taking the time to program them may not be the best choice for the patients. This process, as well as the time it takes to learn the operations of the device, can be extremely lengthy. With this in mind, acute care AAC will often utilize low-tech means, such as communication boards, letter boards, and a variety of unaided means, such as gestures and facial expressions. It's the SLP's job to create general low-tech systems that can be utilized by a variety of patients with various etiologies. The system should include vocabulary related to pain, medication, basic necessities, and a clear yes and no system. Access to this vocabulary is essential to ensuring patient safety. These low-tech systems can be placed in every room or in a designated location that the nursing staff knows where to find it. Communication of where these AAC devices is essential to making sure the nurse will have access anytime a patient comes into the unit with communication needs. Outside of basic communication, it's also the SLP's job to provide access to more individualized AAC systems when time allows for it. This can include signs above the bed detailing important medical information about their diagnoses that people coming into the room would need to know. An example of this would be a sign indicating that somebody had a stroke and how this stroke will affect their communication with the professionals that are working with them. This can also include teaching relevant signs to the patient and family, so even when they come home, there's a communication system in place to keep them active in their lives. In summary, there are many types of AAC ranging from unaided to low-tech and high-tech devices that can be implemented with a variety of people with varying diagnoses, many of which we will see in the acute care setting. AAC enhances communication for people in the acute care setting, but it isn't being utilized nearly enough for a variety of reasons. Lack of education and access to AAC are two of the main barriers as to why the implementation of AAC in the acute care is not widespread, as reported by nurses. And lastly, SLPs have the ability to provide training, information, and the access to AAC patients, families, and medical staff need to effectively use alternative and augmentative modes of communication within the acute care setting and beyond. Everyone deserves a voice, and it's our job to make sure they have that, regardless of the setting they're in.